In the city suburb of Avondale, Field Officer Tracy Hammond is about to get a call to an unusual job.
It's Tracy.
Go ahead.
I have an emergency at Western After Hours. There is a Dachshund that needs to come back to base. It's pregnant.
Okay, then we're on our way.
The private vet clinic is holding the dog for the SPCA after she was surrendered by her owners who couldn't afford vet treatment.
Hey. She looks very weak, very pale. We need to get her back pretty quickly.
The Dachshund's been in labour for 16 hours. She and her pups are now in danger.
The worst case scenario here could be that the pups are not alive anymore, that are retained within her, but she's definitely due an emergency cesarean, which will hopefully at least save her if we can't save the puppies.
But notes left by the vet reveal she has already given birth to one of her puppies.
Her name's Poppy, and the puppies have got stuck. She's managed to get one out.
And nestled under Mum is a surprise survivor.
There you go.
It's now a race against time to get Poppy and her baby back to the SPCA hospital.
I've just picked up the miniature Dachshund from Western After Hours.
She's really pale and cold, so we need someone to see her pretty urgently.
At the SPCA hospital, vet Peter McQueen is assessing the pregnant dog Poppy and her pup.
Hey Peter, we've got this little Dachshund here that appears to have been mated with a Shih Tzu, which is a lot bigger than what she is. It appears she has some puppies stuck inside.
Yeah, she's definitely got a few more in there, hasn't she?
This little puppy seems to be okay.
Yeah, no, it seems to be feeding okay, and she's certainly not bothered at all. Like, you know, she's quite happy to be suckling it.
And so you think there's any chance of some of the puppies inside being saved?
Well, it's hard to say, because it's been quite a long time.
Yeah.
The only options really is to open her up and just see what happens. You know, we can't leave her like this, so it's going to be surgical, whatever we do.
Poppy needs an emergency caesarean, but the surgery is risky.
When we picked up the dog, she was quite weak and pale. Is that going to be a risk when putting her under anaesthetic?
Obviously, it's going to be a greater risk than a normal anaesthetic, but we haven't got any choices anyway, so it's either anaesthetise her or put her to sleep.
Hopefully she'll be good. Good girl.
At the hospital, vet Peter is performing an emergency caesarean on Poppy.
So I'm just trying to lift the uterus out with the first puppy, and the puppies feel really large. And one of the problems with Dachshunds is they're pretty poorly designed when it comes to giving birth, and they're notorious for having to have caesareans.
It's a big one.
They are very big. I'm surprised that she actually managed to get one out. Are you guys ready?
Yeah.
She has been in labour so long, her unborn pups have only a slim chance of survival.
It's not looking promising. Yeah, just give it a run and see how you go with that.
You have to be a bit vigorous to stimulate the breathing in the heart.
Just see how you get on with that.
Is there any more in there or not?
No, there's just two.
Cool.
Things are looking bleak for these two pups.
Just give it a couple of minutes and just rub, but it would be extremely unlikely for them to be alive.
Oh, there we go. We're alive.
Against the odds, one pup starts breathing.
Got a gasp here.
Yay! Jackpot!
You've got to keep rubbing them for a while after they start breathing. Usually the mother would lick her puppies to stimulate them to breathe, and that's sort of what we're imitating here.
I think he's ready for breakfast. Oh, you're hungry, aren't you?
Like proud mums, the vet nurses care for their miracle babies.
So was yours a girl or a boy? Girl! So we're just going to put these little girls in with their brother.
Pretty pushy right from the start.
But as Peter is stitching up Poppy, events take an unexpected turn.
There's a real alarm.
I'll stay with Peter and everyone else has to leave.
Fire alarms has gone off, so everybody has to evacuate the building.
At the SPCA, a fire alarm has gone off and most staff have evacuated the buildings. But Peter and vet nurse Kirsty Gore won't abandon Poppy in surgery.
She just sounded a little bit gurgly, so we put her head lower than her chest so that if any fluid is going to come out, it can come out quite easily.
We just got to be a wee bit careful. The one thing we don't want it to do is to vomit under anaesthetic and then inhale that back down.
That seems to have sorted itself out now.
All clear, thank you very much. If you can all go back to your own positions, thank you.
Fortunately, it's a false alarm.
Fire alarm was an interesting interlude, wasn't it? And we need to get in with her pups so that they can attach and bond to her and hopefully start feeding.
Despite her series of ordeals, Poppy seems to be pulling through.
We've got her on a heat pad because she's had long surgery, so we want her to regain her body temperature so that she's awake and ready to start feeding puppies and looking after them.
But this new family is not out of danger yet.
Obviously, the puppies have to bond to her, they have to feed.
Come on, sweetie. I'm trying to get these 2 pups that came out of the C-section to latch on, and at the moment they're being a little bit reluctant.
You know, we'll know within probably 24, 48 hours whether or not it's all going to be successful.
There you go.
4 days after a traumatic delivery, the Dachshund's pups are thriving.
She's a great mum. The puppies are growing really well, they're feeding well. Oh, they're just so hungry little suckers, aren't they?
But Peter is still concerned about the mum, who SPCA staff have renamed Jem.
Initially, she just didn't want to get out of bed to eat, so she was being hand-fed, basically. She is pretty thin, so we're going to have to monitor her weight, but she is eating well now. The puppies are just doing really well. And it's probably a good thing that there are only 3 because she's so small and she has, you know, she's not in great condition. So the fact that there are only 3 means that they'll do better and that she'll do better too. So the next step is to send her out to foster, and they'll stay at foster at least 6, 8 weeks.
Jem still has a way to go before she is back to full health, but Peter has a little doubt about her future.
She's such a lovely girl that I don't think she'll be up for adoption for very long. I think she'll be snapped up pretty quick.
5 weeks after their birth, the Dachshund pups are thriving. Their foster mum has successfully introduced the pups to solids, and the mother Jem has started to eat again.
And they're doing really well, as you can see. Little podgies. Yeah.
Here we are. Hi, Jem.
Today, the family gets a visit from vet nurse Kirsty.
I've come to check that they're all making progress and just to have a cuddle, really. She's looking absolutely fantastic. For feeding 3 puppies, she's looking so good. They look so much different.
Kirsty has good news for these puppies.
All these puppies have got homes already, which is fantastic.
And Liz has good news for Jem.
There you go. Jem's staying with me. She's going to live with me, yeah. I think she'll miss the babies when they go, but she'll be fine. She'll be really fine, yeah.
For an unwanted dog that then needed emergency surgery, it's an amazing outcome. And Jem will be keeping her new SPCA name.
Couldn't change her name. She's just the right little Jem, yeah. She's well named, isn't she? Hey, little girl.